Fibroids are basically the smooth muscle tumors of the uterus. Uterus is our main organ which is responsible for babies. It's the organ where the pregnancy happens, and uterus has 3 layers. Innermost layer is the endometrium, because of which bleeding happens. And then middle layer is muscle layer or myometrium, and outermost layer is serosal layer. So fibroids are the tumors of muscle layer of the uterus. Fibroids basically is the most common tumor, or you can say lump, in the uterus, which is present in the reproductive age group, and it is there in approximately 25 to 30% of our outpatients department. So how a patient comes to us with fibroid, which problems patients can face? The most common problem or most common symptom which patient face is heavy or abnormal uterine bleeding. The bleeding may stay for 5-6 days or 7-8 days. It may be very heavy. They need to change the pad 7-8 times a day. And the other common symptom is pain or abdominal distension. The fibroids which grow towards the cavity of the uterus or the endometrial lining, they are basically responsible for heavy bleeding. And the same fibroid, if grows towards the outside of the uterus or serosal layer, they are subserosal fibroids, and they mainly cause pressure symptoms. So patient may feel a lump in the abdomen. There may be some bowel or bladder symptoms like abdominal protrusion, abdominal distension, or gaseous feeling, or constipation, or frequency of the urine. And then fibroids may be responsible for infertility or recurrent abortions. Patients having fibroid may face difficulty in getting pregnant. And sometimes, if the fibroid is towards the cavity or submucosal, patient may have severe pain during periods. And those patients, those who are having heavy flow or abnormal flow, they may be anemic. So they may have generalized body symptoms like fatigue and generalized body pains, and they may present with anemia, chronic anemia also. So if we talk about the risk factor, there are no straightforward reasons for the fibroid. You may be genetically more your genes may be little bit more susceptible of getting the fibroids, or you may show some familial tendency, but there is no direct relationship with anything. Some hormonal factors, some reproductive factors may be there, but mainly these are your genes or your chromosomes which are responsible for it. Stress and diets are basically related with every illness nowadays. We will say that healthy lifestyle and healthy diet should be our motive. Every disease nowadays is related to your lifestyle. So fibroids may also be related to healthy lifestyle. If you have unhealthy lifestyle, you are having more smoking, you are having more alcohol, you are having more junk food or fatty foods in the diet, then because certain hormones, fibroids are little hormone dependent. If you are obese, then estrogen hormones are there in your body in excess, and that may increase the growth of the fibroid. So one should have always healthy lifestyle and healthy diet. We cannot really prevent the fibroids, because if it is familial, it's related to your genes, you cannot really prevent the fibroids. But if you have a healthy lifestyle and you can decrease the obesity, maybe you have less chances.